So you're big on sedation dentistry. Most of the procedures you say you do, the patients are lightly sedated.
Absolutely. It's better because the patient's so relaxed when we do it under sedation, right? So there are three basic categories when we do sedation. One is nitrous. So most of the patients are aware of nitrous. It's gas. They're relaxed. They're calm. We can do the procedure. The second is oral sedation, where we give them a pill the night before and the pill on the day of the procedure. The night before? Yes. Which calms them. Because, Randy, if you're getting a colonoscopy tomorrow, are you going to sleep better tonight? If you're getting all the teeth pulled out of your head tomorrow, are you going to be able to sleep well tonight? Out. Yes. So that pill the night before is going to give you a good night's sleep. So you relax, your blood, if you have blood pressure issues, under control, right? Okay. So you're not stressed out. The next day when you come, you're already nice and relaxed, and we'll give you another pill to supplement it. And then if you need a little bit more, we'll give you a little bit more. And then you're very relaxed, very calm, and we do the procedure under that. Then third is IV sedation, where we put IV line and then we give medication through the line and you are sedated. So those are the three basic procedures.
Now, is it true some of these people, they get a full mouth, brand new set of teeth with dental implants, and they have very little memory of the procedure?
Yes.
Really?
That's how the medication works. It has retrograde amnesia. That means they don't remember anything which was done after the medication was given. So they don't remember the procedure. So it works really well.
Safety.
It's very safe. We do the pre-screening before we do anything, before we see if they're a candidate. So we don't do procedures, sedation on patients who are not candidates.
Okay.
So it is very safe, just like getting any of the pills.
So you monitor what?
We monitor blood pressure, oxygen, and the heart rate during the procedure. So if any of those goes low, then we know that we need to intervene and bring it to a stable condition. So it's very stable. It's very safe to do those procedures.
Now, another thing about sedation, you say that you can do a lot of work in one day, like 6 months worth of dentistry in one day with sedation. What do you mean by that?
So when the patients are calm and relaxed, you can work faster and more efficiently, right? So you're not going in and out of the procedure. So that helps you to get a lot of work done in one visit. And that's one of the reasons why patients don't go to the dentist, because they're afraid of, they hold back on getting dental work. Not always.
Well, it's not fun, for sure. Yeah. I'm not afraid of the dentist, but I don't like going to the dentist.
Yes. So when you're sedated, then we can get a lot of stuff done in one visit. Good. We can pull a lot of teeth. We can do a lot of dental implants. We can do a full mouth of crowns. We can do a full mouth of cavities. We can do a bunch of stuff in one visit when they're sedated, because they're calm and relaxed.